Hi, my name is Sarah Al-Suwaidi. I'm the PA student who's going to be examining you today. Could you just verify your name and date of birth for me, please?
And it's Mariam Tahir, and then date of birth is 3/15/93.
Okay, and do I have your consent to go ahead with today's exam?
Yes.
Okay, great. And so what brings you in today?
So I was cutting turkey for a Thanksgiving dinner, and I had my family over, and I was just doing it quickly to make it on time, and then I accidentally cut my forearm.
Okay, can I see the cut? Okay. And how long ago did this happen?
6 hours ago.
6 hours ago. And has it stopped bleeding?
I tried using an old kitchen rag to cover the wound, but it's still bleeding. It's not stopping. It's not working.
Okay. And did you try to apply anything else, like any Band-Aids or anything?
No, I just covered it with the
rag.
With the rag, yeah.
Okay. All right. So I'm going to just ask you a few questions. How's on a scale of 1 to 10? Are you feeling like any pain?
Yes.
Okay.
It's always.
How severe is the pain?
It's 5 out of 10.
Okay. And did you try washing it or anything?
No.
Okay. All right. Do you have any past medical history?
Like just the regular cold, and I get sick normally. Like.
All right. Are you taking any medications?
Just the over-the-counter, like multivitamins.
Multivitamins. Do you have any allergies to anything?
No.
Any like any food or any medication allergies, stuff like that? Okay. Did you try cleaning the wound with? You said not with water, but did you try like any bacterial spray or anything like that? Any ointments?
Not really.
Okay. Do you remember the last time you took a tetanus shot?
I don't remember exactly, but it's been within a year. Recently. I'm not sure exactly the time.
Okay. Do you know what kind of knife you used? Or is it just like just a random?
Okay, what kind of knife?
Like, was it blunt or like really sharp or like a tool knife, or was it just a kitchen knife? Or
it was a kitchen knife.
Just a normal kitchen knife.
Normal kitchen knife.
And are you right or left-handed?
I'm right-handed.
Right-handed. What do you do for work?
I am a student.
Student. And does anyone live with you at home?
Yeah, my family, my daughter, my husband, and my mom.
All right. Are you taking any drug, or do you use any recreational drugs?
No.
Do you smoke?
No.
Do you drink?
No.
Okay. All right. So I'm going to go ahead and perform a physical exam today on you. So I'm going to take a look at the wound. First, I do want to just clear away some of the blood and everything. I do see that it's a laceration and that it's in your left forearm. It's ventral and medial, on the medial side. And I do see that it's a partial thickness wound, so it's not too deep and it's not superficial enough where I can just apply like a bandage or like some kind of bandage or a wrap or something. So we will be needing to do a little bit more. And you said you used a kitchen towel. So there is a high chance, or like there is a chance of contamination.
Yeah.
So we will probably be using like antibiotic creams and stuff, and we definitely will need to be irrigating it, just cleaning the wound. And are you able to use your arm? Just move it back and forth for me.
It's painful when I move it. Yeah.
Can you move it side to side? Turn it.
I can do it, but it's painful.
Okay. All right. So you do have a few treatment options that we can do today, but first and foremost, we do need to irrigate the wound. We need to clean it by using a syringe irrigation. We can use the 35 or the 50 milliliter syringe, depending on just what we have. And a 19 gauge blunt needle is what we usually use. It's connected to a reservoir of irrigating fluid, so that's the one that we use. We also typically use saline since it's not too deep and it doesn't look like there's much foreign body in it and every foreign body's in it or anything. So I'm just gonna use like the normal saline. We'll clean it and we'll clean the wound and the surrounding skin with the saline under pressure. Okay. So now we're going to decide whether or not to close it and how to do so. So you do have a couple of options. You can do suturing, or you can do something called Dermabond, which is like a skin adhesive. For suturing, since it is a bit deep to the dermis, that is an option. We would put sutures with primary intention, which means all layers are closed with the sutures, and there's a better chance of minimal scarring. Other benefits include like less time needed for the wound to heal, reducing the likelihood of infection, decreasing the amount of scar tissue to form, and like I said, because of that, you get better, better scar tissue, just better looking, a better looking wound, I guess. There are, though, some complications that could occur, although they are not as likely to occur, such as like infection, scarring could occur, and possibly keloid formation. You could lose function in your arm. However, like I said, it's not very likely, and it's like the benefits outweigh the costs. You know what I mean? We can also close the wound with something, like I said, called Dermabond, which is the skin glue that works fast and holds the skin well. However, there is a higher risk of infection with the Dermabond. Also, if you accidentally take off part of it, or if some of the ends come off or come loose, or maybe you soak in water a bit too long or something, or since you constantly use your left arm, maybe while you're cooking or something, you could have a chance of ripping off the whole glue, the whole adhesive. Although it is strong, but there is a chance. You can take baths with the Dermabond, but be sure you can't really soak in it. Same with the sutures, no soaking. Always have to readjust your wounds. Just don't go in baths, pools, hot tubs, things like that. We can do either of those, but which one do you prefer?
Because I do a lot of cooking, and I think for me suturing will be best.
Suturing?
Yeah,
Okay.
it would be better.
Alright, so since you do prefer the sutures, we have the non-absorbable sutures, so that means that it won't break down over time, and you come in a few days and we just take it off, just cut them out. So the needle that we'll use is a 4-0 nylon monofilament. Do you have any allergies to nylon or
No.
anything? Okay. I also use an anesthetic to numb the area. Are you allergic to any anesthetics?
No.
Okay. We will also be doing a simple interrupted stitch, so we'll be stitching or suturing, tie it off, cut, and then a half a centimeter forward, do the same thing, cut, and it'll just be an interrupted instead of a continuous thing. Okay, since most lacerations are closed that way, we feel that that's the best way to go. I do want to do some imaging, just in case that there might have been maybe some bone on the knife that might have gone into your laceration. So I'll be doing an X-ray just to check if there are any foreign bodies. Like I said, maybe some turkey bone, or maybe some piece of the knife or something. So we'll do that. And since you're not really sure when you had your last tetanus shot, I do want to go ahead and give you one. Since you did use a kitchen knife, I'm not really sure how dirty it was, how old it is, and if it was a bit rusted or anything like that. So I do want to go ahead and do that. So we'll give you that. So before we do anything, we'll be cleaning it. Like I said, we'll be applying the anesthetic, and then we can start suturing. But after the suturing, we'll be applying an antibiotic cream. Most likely we'll be using Neosporin. But we do have to use that with caution. Do you have any allergies to Neosporin or anything?
No,
or neomycin or
not
anything?
that I know of.
Okay. So we'll use Neosporin ointment, and then we'll dress the wound with the gauze. And this will limit suture disturbance and allow for easier removal when you come back in. You will need to keep the wound as clean and dry as possible. So don't submerge it, don't soak it in water. Like I said, definitely avoid using the hot tubs and everything that I was talking about. Try to keep, if you're taking a shower, try to keep it as dry. Maybe you can put a plastic bag over it or something, or you can keep your arm out of the water stream or something like that. So you can clean it gently with soap and water just to keep it clean. So when you're redressing your wounds, which would occur about every 24 hours, you'll be applying a new gauze and just cleaning it. So like I said, you can use the soap and water just gently just remove around the area, not like scrubbing or anything like that.
Okay.
Don't scratch at it.
Okay.
Just around the laceration.
Mhm.
So you'll be, when you redress, once you after you're done cleaning, pat it dry. You can apply the Neosporin again, and then you can have someone in your family just help you out with putting the gauze on again. And then you'll be following up here in about 8 days, since it's on your arm. So you'll follow up here in 8 days, and we'll take a look at the wound, see how it's healing, see if there's any infection, or if there's any redness or like any signs of infection. And then we'll just remove the gauze and remove everything, clean it again, and then we can take out the sutures when you come back in your next visit. But while you're home, we want you to monitor for any signs of infection, such as like appearance of pus, redness, if you have any pain, a fever, or if you have any hypertension, palpitations, or anything like that, burning, or like extreme itching. You probably will feel some like discomfort around the area for the next few days once the sutures are done, but just make sure not to scratch at it or anything like that. If these things do occur, like any signs of infection that you or your family notice, then follow up the clinic as soon as possible. Okay? Does everything sound good? Do you have any questions for me?
No, I think I'm good.
Okay, all right.
Thank you.
So we'll go ahead and start with the cleaning and then suturing and everything. And I'm gonna go talk to my preceptor before I do any of that, so that we can come up with our next steps. Okay?
Okay.
All right.
Okay.
Thank you.
Thank you.
All right, so we have a patient who is a 31-year-old Asian woman who presents to the clinic with a 2-inch laceration on her left arm that occurred 6 hours ago from cutting a Thanksgiving turkey. It's located ventrally and medially on her left arm. She says that it occurred 6 hours ago, and it's a partial thickness wound. It's kind of deep to the dermis, and we did give her the options of using sutures or the Dermabond, and the patient chose sutures. So the patient states that she did not try to clean the wound, that she used a kitchen towel to apply pressure, and she says that it was a used kitchen towel, so we are fearing a possible infection. So we do want to apply the antibiotic ointment, which is the Neosporin. The patient denies any allergies, she denies taking any prescription medications, and she only takes like over-the-counter multivitamins. She just, for her past medical history, consists of just some common colds, flu and things like that. She did not try to clean the wound. She didn't try to use any antibacterial spray or ointment when she was at home before coming in. The last time she took her tetanus shot, she doesn't remember exactly when, but she does say that it was pretty recent, within the year. But we do want to go ahead and give her another tetanus shot, since she isn't exactly sure when she had her last one. And she did use a kitchen knife, so we're just afraid of like any like maybe rust or something, and we're not really sure how old that kitchen knife is. And she says that she is right-handed, and so she's able to use her right hand. It's just that her left hand hurts when she moves it around. She states that she's a student, so she does not currently work, and she lives with her husband and kid, and she doesn't drink, she doesn't smoke, and she doesn't take any recreational drugs. So like I said, it is a partial thickness wound, and she does prefer to do the sutures in order to close the wound. So we will be irrigating the wound using a 50 milliliter syringe with a 19 gauge blunt needle connected to a reservoir of irrigating fluid, which will be saline in this case. And then she says that we did give her all of the benefits of suturing and the risks or complications of suturing. We also give her the benefits of the Dermabond and complications. But like I said, she prefers the sutures, so we will be using a non-absorbable suturing method, or the sutures, so that it won't break down over time. And the needle that we'll use is a 4-0 nylon monofilament. The patient denies any allergies to nylon. We will also be using anesthetic down the area. She denies that she's allergic to anesthetic. And the type of stitching that we'll be doing is a simple interrupted stitching. And we also ordered an x-ray to make sure that there are no foreign bodies, such as like the bone from the turkey that she was cutting, or maybe like pieces of the knife or something. And we also, like I said, be giving the tetanus shot. And then her follow-up plan included her coming back in 8 days, We educated her on redressing the wound, on using the proper ointment, proper creams. Well, we told her that we'll be using Neosporin, so that's what she'll be using at home. We educated her on how to remove the dressing and how to clean the wound gently with soap and water, and we advised her not to submerge the wound or soak it in water, and to avoid like pools, hot tubs, or any areas of possible contamination. We told the patient that she can follow up in the clinic in about 8 days to take out the sutures, and to also allow herself and her family to monitor for any signs of infection. Okay, thank you.